Joe.
Hi, Shauna.
It's me, Shauna again, occupational therapist, student, Nashville State Community College. We're going to be looking at a diagnosis today of manic behavior with bipolar as a diagnosis. So like last time, we're going to be talking over the diagnosis, maybe some concerns you may have, what discharge looks like for you, and then also going over a treatment that we would be doing while you are at a psychiatric clinic, rehabilitation clinic. So your current diagnosis, like I said, is bipolar, and you were functioning independently at home without any difficulty and started having some manic behaviors, specifically cleaning the home several times daily, spending hours and thousands of dollars purchasing items online, and your speech became rapid and less coherent than usual. You were hospitalized for 2 weeks at a psychiatric unit and placed on medication and discharged home with outpatient psychiatric monitoring, but things have increased over the last month. So now you're in a longer psychiatric hospitalization rehab facility, and you voluntarily committed yourself, and it's going to be a 30 to 60 day stay. With your discharge plans here being to home with a day program referral. So you do have some short-term and long-term goals within 3 weeks. Your short-term goals are to safely and independently perform ADLs and in-room IADLs without exhibiting bipolar symptoms. We talked about that. That's just your standard activities of daily living, and then instrumental activities of daily living, such as house cleaning, meal preparation, things like that. And your other short-term goal is to participate in occupational therapy, leisure, and social group activities once a day without exhibiting bipolar symptoms. And that refers some to your rapid speech and being less coherent. And then your long-term goals by discharge is that you'll be able to plan and follow a daily and weekly schedule of activities within the inpatient setting without exhibiting bipolar symptoms, that you would research and choose a day program available near your home, and that you could plan a budget for online purchases and set up mechanisms to block excessive purchases. So for you, increased independence for discharge will look like safety while doing the things that the ADLs and IADLs. At this time, you currently have a standby assist and min assist based on your level of coherence. And also safety and independent with your IADLs, which right now you're getting like verbal cues at mod assistance levels. And then also, of course, dealing with some of the excessive spending and the budgeting and having some independence in that. So when you get home, it can have less of an impact on your home environment and the people around you. So I wanted to talk a little bit about maybe some of your concerns with this diagnosis and what it would look like at discharge, coming back home after your 30 to 60 day stay.
I would say the first thing would be finances.
Okay.
Just protecting my family from the physical aspects of the cleaning and the purchasing. And maybe that's something that would be an easier thing to do something about.
Right.
Some of the other things that could be implemented right away.
Yes.
So options for that would be great.
Monitoring symptoms. And do you have any concerns about the impact it would have on your family?
Well, yeah. I mean, you don't want to ruin your family's life, financially. It affects everybody around me. So,
right.
First and foremost, I don't want to get that under control. I don't see how we could do the other things that need to be done without that. That would just create a lot of other problems that I think would get in the way of treating the symptoms, and
Sure.
because I would need my family on board and have to have money to pay for things. So
right.
So dealing with that first, it would give me more peace of mind, and I think would create some stability around the house to where my wife, my family could be more involved with helping me out. So
Right. And I think based on the original occupational profile we did, your wife works from home.
Yeah.
But you do the primary, do a lot of the cleaning and taking care of the home while you are here as well. So I think it would have an effect on her for sure, because she's here trying to work, and you manage most of the finances when it comes to some of that.
Yeah.
And work around the home. So yeah, absolutely. And then we had talked a little bit about this before the video, and you had mentioned that you were worried a little bit about maybe how this diagnosis could manifest in other ways.
Yeah. I was worried about, so the spending as being kind of a symptom, a manic symptom. What happens when, let's say, we do control that, or at least get a handle on it and, limit my spending or however, like, is that going to manifest in other ways? And what would that look like? And because that isn't a cure.
Right.
It's not a cure. And so that would be a concern of mine of, having the people around me monitoring that.
Right.
And new symptoms that might come out.
Right.
And this other one is when I'm sort of disabled from doing that aspect, I would imagine it would come out in other ways. And so just being concerned about what that would look like and how that would be identified and my willingness to receive it.
Sure.
Because you think you're normal, you feel normal.
Right.
And nobody wants to be told that they're not.
Yeah.
So
it would definitely affect your role as like the head of the household.
Yeah. And there are trust issues, and you get angry and frustrated.
Sure.
Nobody wants to hear it. And so, so concerns about, is there any kind of mechanism to where that would help me in those times to understand that and to respond in a positive way to that.
Sure.
And actually respond to it as opposed to just denial.
And what I'm hearing too is that you have concerns even like at this point, you have come home once and things increased. And so you had to go back in. Yeah. And you were on medication, when you first were dismissed. So maybe there's some concerns about, is the medication going to work? Is my wife going to have to monitor me forever? Is it going to manifest in other ways? How is it going to affect everyone around me? We did look at some of the concerns here about, community and reentry and driving with your socialization with other people, and, your home environment. And you mentioned, do we have to lock down cleaning supplies so that I'm not getting in there? What does this do with my wife? Do I like hyper focus and obsess when it is time to clean? So the goal, again, you've got a lot of goals here in this treatment, 30 to 60 days. And the main focus always of occupational therapy is to have as much independence as possible. Caregiver training is really important, but the goal would not necessarily be to have staff, your wife, manage everything.
Right.
And have to do everything for you and monitor everything. The goal to be able to discharge would really be to look at independence and trying to address these issues. Maybe it is changing medication, and there's an interdisciplinary team you'd be working with, a psychologist there, a medical doctor, to find the right prescription that could work for you. And it would be an idea that you wouldn't be discharged until you had met the goals of certain independence levels, so that it doesn't ruin your family's lives.
Right. Right.
So one of the treatments, I wanted to focus on that long-term goal of planning a budget for online purchases and setting up mechanisms to block excessive purchases.
Right.
You did mention that this was your first kind of top concern, was your family support and the financial aspect of things. So what that would look like would be sitting down and really planning a budget, looking at what parts of the budget are yours to be in control of and to pay, whether it's, billing or what, and how much leftover there is for spending.
For supplies.
Right, and kind of maybe, we'd have plenty of time to go through this, but hopefully, get to a point where you can have a realistic amount for expenditures and be able to kind of gauge the priority of what's really needed and what's just excessive spending to cope. And I actually looked up a couple different mechanisms. So one of the things, do you have Apple phone, like an iPhone and Apple Pay on there? Okay, so Apple Pay is great because it's one of the online bankings you can use that actually has limits that can be put restrictions on there. And this may even be something that, Steph could be a part of, since you guys budget maybe together some. And she could maybe help, especially if you have an Apple family plan, that you can set up restrictions. So we would, come up with the budget and then decide how much for daily you can do, daily restrictions for your account and your banking. There's also other ways that we could find, like mechanisms for blocking excessive purchases could be prepaid cards for a certain amount, maybe per day, almost like where you can have an allowance added in. It could either be from staff or possibly automatic. that kind of comes out.
Yeah.
And, you know, it would kind of be where we would have to find what best works for you.
Okay.
And we would figure that out through the course of treatments together, and then really work on sitting down and setting up all of it. So that with today's day and age, most things can be digital.
Well, that's true.
Hands
That's
off.
right.
More independence for you.
Yeah.
But then also a little less maybe for staff to have to
I have
manage.
to be hands-on monitoring all the
All
time.
right. Well, thanks for your time.
Thank you.